Hello and welcome. Today, we're going to be talking about something that's so important, childhood depression. We're going to break down the warning signs to look for, and then we'll walk through the clear supportive steps you can take if you're worried about a child in your life. So let's just dive right in.
You know, this really gets to the heart of it, doesn't it? It's that feeling you get in your gut as a parent when the light in your child's eyes just seems a little dimmer, or when they're just not quite themselves. This isn't about one bad day. It's about a change that sticks around, one you can't help but notice. Okay, so first things first, we have to understand what we're actually talking about. It is absolutely crucial to know the difference between a child just having a tough week and a more persistent condition that really needs our full attention and support. Now, the one word on this slide that I really want you to focus on is persistent. See, we all have bad days, right? Kids have mood swings that come and go. But what we're talking about here is different. Depression. It sticks around. It's a mood disorder that really settles in and can affect a child's entire world. And you can see here just how wide-ranging those effects are. It's not just about emotions, like feeling sad or irritable. It can actually show up as big changes in their behavior, like pulling away from their friends. It can mess with their thinking, making it tough to concentrate at school, and it can even have physical symptoms like not sleeping or eating the way they used to. It's really a whole body, whole mind issue. All right, so now we're going to get into the really practical part of all this. What are the specific things we should be looking for? This is where we take that gut feeling we talked about and turn it into concrete observations. So let's just ask the question directly. What are the most common clues that a child might be struggling with something more than just a passing blue mood? These behaviors are really key. And the most important thing to look for is a change from how they normally are. Maybe you have a kid who absolutely loved playing outside, and now they have zero interest. Or a super social child who now just wants to be alone in their room. Things that used to bring them joy now just don't. And pay attention to that complaint of "I'm bored," because sometimes that can be a mask for a much deeper feeling of emptiness. And, we just have to listen to their words. These are not just throwaway comments. When a child says something like "I'm no good," or especially something as serious as "I wish I weren't here," that is a direct window into their inner world. It's a sign of a real struggle, and we have to take it seriously every single time. Now, this is so important, and it's something a lot of people miss. We expect depression to look sad, right? But in kids, it often shows up as being really irritable or angry or just acting out. Why? Well, think about it. Kids don't always have the words to say, "I feel hopeless and heavy." So that giant, overwhelming feeling gets short-circuited and comes out as frustration or defiance. A child who seems angry all the time might not be a bad kid. They might be a really sad kid who just doesn't know how to say it. Okay, so maybe you've been nodding along, you've noticed some of these signs. The big question then becomes, well, how long is too long? When does being concerned turn into needing to take action? The guidance on this is actually pretty clear and direct. If those core signs we've been talking about, that persistent sadness, the irritability, the loss of interest in things, if they've been going on for more than 2 weeks, that's a really strong signal that it's time to think about getting a professional opinion. And on top of that 2-week guideline, there's some other major red flags. I mean, if they're pulling away from their friends, if they're talking about feeling worthless, or if you know for a fact that they've gone through something tough, like bullying or a loss in the family, these are all really compelling reasons to go ahead and seek some guidance. I really want to pause on this for a second because this might be the most empowering message for any parent or caregiver out there. You know your child better than anyone. You do. And you don't need to wait for things to hit a crisis point. If your gut is screaming at you that something is wrong, that is enough. Reaching out is not a sign of failure, it's a sign of proactive, loving care. So what does reaching out even look like? I know the idea of getting an evaluation can sound kind of scary, but it's really just a collaborative process. It's designed to understand and support your child, not to judge or label them. Let's just walk through what this actually looks like. It all starts with safe, confidential conversations for you and for your child. Professionals then use some standard screening tools to get a clearer picture of what's going on. They'll also look at the whole picture to see if maybe anxiety or stress are part of it too. And then, the final steps are all about teamwork, creating a counseling plan together and making sure the school is on board to help out. The whole goal is just to understand what's happening and figure out the best way to help. Okay, let's tackle one of the biggest fears that can hold a parent back. There's this myth that if you bring up depression, you're somehow going to plant the idea in their head or make the problem bigger than it is. So let's get right to it.
The answer is a clear, firm, absolute no. Talking about it does the exact opposite of making it worse. It shatters the silence. It lets your child know that they are not alone with these huge, heavy feelings. An honest conversation is the first and maybe the most important step on the path to healing.
And here it is, the other major worry for so many parents. Does getting help automatically mean your child is going to be put on medication? What's the real story here? This should be really reassuring to hear. For most kids, therapy is the first line of defense. Things like talk therapy or cognitive behavioral therapy are all about giving them new skills and support. Medication isn't the default answer. It's a tool that's considered, but usually only if the symptoms are really severe or just aren't getting better with therapy alone. So after all of this, after looking at the signs, the evaluation process, the different kinds of support, what's the single most important thing to remember? It's this. Your role as a parent or caregiver is absolutely massive. Your love, your support, your willingness to listen, and your courage to ask for help, that's the real foundation for their recovery. And that's the thought I want to leave you with today. We would never ever hesitate to take our child to the doctor for a broken arm or a fever that won't go away. Their mental health, their emotional well-being deserves that exact same level of care and attention and urgency. Trusting your gut and reaching out for support isn't just okay, it's one of the most powerful and loving things you can do.